There's a couple different. When you use the term medical device, it's usually very broad. A medical device can be anything from, like I said earlier, a Fitbit, all the way up to like a pacemaker that's installed inside of a patient's body. So we have many different categories, and I break them down like this. There's a category of medical devices which are in their own ecosystem. Those can be like pacemakers. They don't connect up to a computer, but they can interface with the outside world a little bit. Then there's devices that are connected to a computer. Those things I think of as like X-ray machines, MRIs. They're medical devices, but they need a computer outside to kind of like a peripheral. Think of them kind of like a printer. And then there are medical information systems, electronic health records, and that's where we get into a lot more of the privacy concerns. So when you divide them up into those three areas, sometimes people think of embedded devices as embedded into the human body. But what really, it can be that, but also an insulin pump is outside of the body, but in an electronic terms, it's considered an embedded device. So there's a lot of different terminology here that mixes from the medical world to the computer world. And that's a really important distinguishment. You asked me specifically about what problems I see with these types of devices. In particular, with all embedded devices, meaning their own ecosystems, the issue of updates has been something that is a real big concern about these devices. Now, we're all used to having updates with our cell phones, and it says, you need to download this, latest update for your iPhone. We don't have that capability with most of our medical devices now. If you want to update your medical device, you have to throw it away and get a new medical device. And as you can imagine, a pacemaker is kind of hard just to throw away and get a new one installed. So one of the big challenges is how do you update software on these complex devices without having to redo surgery or without having to completely replace a $10,000 device and put a patient at risk? And it's a big challenge.